Welcome to Overcoming Physician Burnout as Health Architects, a series in which we talk about different ways that physicians can approach their clinical work to make it more rewarding and fulfilling. This is Venkatesh Ramnath. Today is episode 22, The Superpower of Slowing Down. If you prefer reading, I invite you to look at the written post, which also includes embedded links for references. Also, a disclosure. I have no conflicts of interest or disclosures regarding the products cited. Previously, we talked about the importance of myths when it comes to understanding our approach to burnout. This includes adopting positive myths, such as that of the health architect, but also discarding outdated or harmful ones, like expecting technology to solve all our problems, or viewing the system as a monolithic demon. We also spoke with communication experts and a formerly active family medicine physician about challenges in communication and self-awareness, often rooted in moving too fast. Today, we're going to introduce a concept and tools related to the opposite of moving fast, that is, slowing down, and discuss why slowing our minds and bodies is not intuitive to many physicians, but is essential in evolving beyond burnout. In today's world, speed is treated as a virtue. The 24-hour news cycle, the constant reach of social media, and the ability to handle almost any task from anywhere on our smartphones, from answering emails to booking flights to editing spreadsheets, are just few of the ways modern life is built around velocity. In medicine, we too are seduced by this kinetic fixation. I'd spent much of my high school and college years rushing to gain the credentials for medical school, juggling multiple extracurricular activities and a heavy course load at the same time. My quest to wear the white coat was predicated on my ability to multitask with abandon. Once in medical school, my drive to do more in less time only intensified. The metaphorical fire hose opened almost instantly. Biochemistry, physiology, anatomy, symptoms, signs, syndromes, and countless other rules of the trade blasted at a pace that sometimes felt like epistemological waterboarding. Survival required a constant mental sprint, while my body was static, anchored to a desk at home or a chair in the library. This changed during my training years, when the mental urgency was matched by the physical. I now found myself darting across the hospital and between clinic rooms like a hummingbird, my limbs and mind in a blur. During these years, lightning-like efficiency and accuracy were always the expectation. No one ever told us, "Hey, slow down." Rather, it was the opposite. I would hear, "Did you finish that case for morning report? What happened to the results of that CT? Have you seen the patient in the ED yet?" The message throughout was clear. I could never be quick or efficient enough. Should our pace slacken, we knew the consequences. The longer you stay, the longer you stay, we warned each other. But even when I avoided that predicament, another rose in its place. I could not exit the Mobius strip of patient care. The more patients I saw, the more tests I ordered, and the more procedures I did, which led to more tests and more procedures. I was caught in an endless loop without an exit. Keeping the cylinders whirring at high RPMs at all hours seemed to be the answer at first, even carrying a certain thrill, but it eventually caught up to me. It affected the way I communicated, as I saw my phrases get shorter and sharper. The average time I spent with patients dropped. I felt anxiety even when completing tasks on time. I pushed more problems to later, but that later never came. The idea of going home and leaving it all behind became increasingly theoretical. No matter where I was, my mind refused to switch off. Speed has seeped into my very way of being, becoming a core part of the lived experience of doctoring, what 4P3R cognitive scientists might call participatory knowledge, as we have discussed before. I shrugged it off then, absorbing the fatigue into the sponge of youthful exuberance. In fact, instead of slowing down, I sped up, heading out to bars and clubs after grueling post-call shifts, hoping that hedonism would neutralize the pressure I carried at work. I was in truth trying to fight fire with fire. But early into my attending years, the pace kept mounting and my reserve kept eroding. I remember my first job out of training, when the institution switched from an older electronic medical record to Epic. Overnight, the workload ballooned. Patients' results, referral requests, and orders for attestations and co-signatures now arrived within minutes instead of hours or days previously, and the expectation to address them immediately grew just as quickly. Inside myself, I could hear groaning. Initially, I again responded the only way I knew, by doing more. I signed orders, answered coding queries, and responded to emails as quickly as they arrived. I updated old policies and protocols and wrote new ones, trying to stay always one step ahead of the next administrative metric to be handed down. Electrolyte replacement protocols, sepsis workflows, early mobilization in the ICU policies. Rationally, it made sense to devise and implement changes to fix the inefficiencies. In my naive mind, it would all work out if I could just push hard and fast enough. But what I failed to see was that real change required stepping out of the state of perpetual motion. By devoting myself to endlessly putting out fires, I had lost sight of how to truly extinguish them, or even imagine what might come after the flames were out. My efforts flailed. I grew more distant from others, lost my sense of control, and slipped headlong into the physical and emotional void I would later recognize as burnout. It was at this point that I realized I had to do something strange and uncomfortable. Slow down. I had to come to terms with the fact that the more time I spent doing things, the less I spent reflecting and thinking. Action had superseded thought, and that left my soul adrift. Simply doing more was not enough. My soul ached for a break. Daniel Kahneman, Nobel Prize-winning psychologist and author of Thinking Fast and Slow, described two modes of thinking: Type 1, or intuitive or reactive thinking, and Type 2, or deliberative, rational, and methodical thinking. Both are essential, though not always in equal measure. Type 1 thinking keeps us from being paralyzed by the endless stream of things we must respond to: a sudden stomach twinge, an unexpected traffic jam, by using heuristics or mental shortcuts to keep life from becoming a jumble of anxiety. Type 2 thinking, by contrast, is what we call on to work through complex problems and make thoughtful rather than rash decisions. And that, inevitably, takes time. My career had made me a Type 1 thinking superstar, but a Type 2 thinking misfit. To overcome burnout, I needed to strengthen the latter, restoring both my agency and my human connection as a health architect. I began devoting more time to the why and how, not just the what, of my work. And more than anything, I began spending time not doing anything at all, or so it seemed at first. Soon, I understood the wisdom in the Buddhist reminder: don't just do something, sit there. So what did I do practically to slow down? Well, I learned that slowing down could happen if I used the following methods. Number 1, breathe. Breathing may seem obvious, even boring, but it is, in fact, remarkably powerful. Evidence shows that controlled breathing can reduce anxiety and stress both immediately and over the long term. This is no secret to those who practice meditation or pranayama, the ancient Indian discipline of intentional breath control. For me, breathing has become a tool for two purposes. First, in-the-moment emotional regulation, and second, long-term stress reduction. In the moment, deep breaths help me shift from reactive emotional responses, that is Type 1 thinking, toward thoughtful, deliberate ones, or Type 2 thinking. Before a tense family meeting or a difficult conversation with a consultant, for example, I often pause for several slow, deep breaths, calming my nerves, sharpening my focus, and aligning my thoughts with strategy rather than impulse. I breathe before inserting a central venous line in a critically ill patient, or just before asking a nurse to push a rapid sedative during intubation. That single inhalation stills my mind and steadies my body, allowing my muscles to be both poised and decisive when speed truly matters. In critical care, where seconds can mean life or death, this is not a luxury. It is essential. Breathing also serves as preventive maintenance. Through regular practice, especially during meditation, I train my mind to view slowness not as a threat, but as a sanctuary. I now look forward to daily meditation as a rare chance to let time slow, even stop, if only for a moment. The calm carries over into my daily life. My racing thoughts settle into a measured trot, sometimes when I will it, sometimes on their own. That ability to notice and shape the tempo of my mind has given me a sense of agency I once thought impossible. Number 2, notice yourself. Slowing down opens the door to noticing what is happening in the moment within us. When I consciously ease my pace, I can step into a third-person perspective, observing my posture, tone, thoughts, feelings, and attitude. Try it out. When a nurse asks for that Lasix order, pause before responding and notice. Does your reply come out warm or curt? On the walk to the ED for a new consult, slow your stride and pay attention. Are you slouching or standing tall? Are you sauntering or rushing? When a patient tells you they've missed their medications again, resist the urge to immediately jot it down on the chart. First, slow down and notice how you felt hearing their words and where you felt it. Was it in your neck, your chest, your head? With practice, emotions like frustration, urgency, enthusiasm, or disappointment become not just passing sensations, but signals we can act on deliberately. Awareness turns each moment into an opportunity for insight and choice, rather than an automatic Pavlovian reaction. This is the essence of mindfulness, learning to respond with thoughtfulness and composure, no matter what the day throws at us. It also shifts our sense of control. We no longer see ourselves as a bundle of chaotic chemical reactions, but as human beings capable of compassion even for ourselves. But mindfulness is not just emotionally grounding, it's also practical. By noticing myself in real time, I can adjust my tone or posture, or both, to communicate more clearly and persuasively. If I sense my facial muscles tightening and my tone edging towards condescension during a discussion, whether it be delegating to a team member or raising an issue with an administrator, I can course correct in real time, keeping the conversation on track rather than forcing it forward and risking derailment. That small adjustment can mean the difference between a productive exchange and a failed one. In the long run, it can even save time. Fewer misunderstandings, fewer meetings, and fewer repairs to regain lost ground. Number 3, notice what is around you. By slowing down, the external world also snaps into focus. We become less absorbed in our own egos and more attuned to the experiences of others. This is one of the less appreciated powers of self-compassion. Too often mistaken for self-indulgence or avoidance, a kind of pity party with our heads buried in the sand, self-compassion is in truth the opposite. The more we deeply connect with ourselves, the more fully we can see and touch the lives around us. Compassion and kindness cultivated within naturally radiate outward. Slowing down widens our perspective, lifting us out of tunnel vision and into a broader awareness of our shared existence. We see ourselves as part of a vast common humanity, billions of individuals, each trying to make sense of life in our own way. From this vantage point, conflict and friction feel less like personal affronts and more like universal human patterns, as Buddhists often remind us. This expanded view offers a powerful opening in the aftermath of burnout. Instead of running endlessly or stewing in resentment over moral injury, we can pause, reclaim our sense of self, and consider how to shape what comes next. Slowing down is not about surrendering to a broken system. It's about stepping into our role as purposeful actors, moving through life with clarity and intent. What does all this talk of speed mean for the health architect? Well, as with most things, balance is key. We must be able to move quickly or slowly, depending on the moment and the purpose. When a patient's blood pressure crashes or they're struggling to breathe from severe COVID-19, speed can save a life. But when we're communicating, whether with patients, colleagues, or administrators, or shaping a cohesive, comprehensive care plan, we must slow down. The best physicians can shift between these modes almost instinctively. The health architect must master both as well, but they recognize that slowing down requires a particularly deliberate cultivation. Why? Well, because first, slowing down restores a sense of agency. As Cal Newport notes in his book, Slow Productivity, by pacing our work, we focus on quality over sheer volume, and in doing so, we deepen our pride and competence. One way is to be open to seeing fewer patients and ordering fewer tests as new goals. This may raise fears of lower reimbursements in a fee-for-service world and more anxiety about not ordering every test available, but what we might gain should not be minimized. More confidence in practicing the scientific attitude and heightened self-awareness. In an age of burnout, these anchor us more than we think, and we can free our repressed creativity from the dungeon of habit and fear. Second, slowing down revitalizes human connection. By pausing and resisting the impulse to react immediately, as health architects, we adjust our approach, strengthen relationships, and work more effectively. We become grounded in our real abilities and limitations, not imagined ones, and are more able to find common purpose with others. No longer reacting like Pavlovian dogs to every stimulus, we lean into self-compassion, and from there, compassion for others. This is the essence of the health architect's approach to confronting burnout, restoring agency while renewing human connection by slowing down at the right time. Take-home point. Slowing down is a powerful, often overlooked antidote to physician burnout. In a profession that prizes speed and constant motion, deliberately pausing allows us to shift from reactive to reflective thinking, regain a sense of agency, and deepen human connection. By breathing intentionally, noticing ourselves, and noticing our surroundings, we move beyond reflexive action to purposeful presence, balancing the capacity to act quickly in emergencies with the wisdom to slow down when thoughtfulness matters most. This balance is key to sustaining both our effectiveness and our humanity. I hope you enjoyed this episode. In the next one, we'll continue with more practical lessons on how to become a health architect, like how to choose the right technology to consider and how to delegate responsibility within multidisciplinary teams to improve our cognitive load. See you then.